Hey, I'm Dr. Jeremy Gierman with Inertia Medical. Today we're going to talk about a common source of anterior shoulder pain. So people come to our clinic a lot for shoulder pain, and they'll say, "Doc, it hurts right in the front here. It hurts a lot when I'm lifting my shoulder, when I'm pressing." We get a lot of athletes in our clinic, so when I'm doing bench presses, and there's some focal tenderness. Actually, it hurts when I press here. And a lot of times this relates to bicep tendon problems. So people, of course, are familiar with bicep muscle. And on occasion, the bicep tendon pain will actually radiate down into the bicep muscle. But a lot of people don't know that the bicep tendon actually goes up into the shoulder, so it can in fact cause shoulder pain. The bicep brachii muscle actually has two proximal tendons, meaning two tendons up near the shoulder, and one of them attaches to a region called the coracoid process, which on Mr. Skeleton here is this bone. And that one seldom has problems with it, or at least far less often than the long head of the biceps tendon, which travels up the arm, and this is supposed to represent that tendon. It travels up the arm through this groove called the bicipital groove, and actually attaches to the top part of the labrum in the shoulder, an area called the glenoid tubercle. So as you can see, people can have anterior or front-sided shoulder pain as a result of this tendon problem. So I'll show you a picture over on the ultrasound. This is a great modality to examine the bicep tendon. So with the probe on the front of my shoulder, in this case this is my shoulder, this white line is the arm bone, and this circular structure sitting in the groove is a cross-section of the bicep tendon. And so what we'll do is put a picture on the screen of a diseased bicep tendon, or at least one that's inflamed, and commonly you'll see fluid around the bicep tendon in sort of a donut configuration. And so the ultrasound, as you can see, it's a very great tool to readily image this area, so that when people come in and they say, "Hey, my shoulder hurts right here," very quickly, really right away, we can take a look and see, okay, is this the bicep tendon? If so, how bad is it? And it allows us to treat also, and maybe we'll be able to find a picture of doing a little injection in and around this area. But one other important thing to mention is that we're big on mechanics here. So we talk about how to alter mechanics, whether it be ergonomics at work, with having your shoulders more back, and there are different braces and harnesses and things that help with that. But then also postural corrective exercises to really strengthen the upper back. Or if you're an athlete that engages in weightlifting, we modify a lot of times bench pressing technique or fly techniques or shoulder pressing techniques. So we go over a lot of this stuff. But anterior shoulder pain, a common cause of that, long head biceps tendonitis. If you think you might have it, we'd be happy to see you. If you have any questions, let us know.